This is going to go over the specific standards and guidelines from the ACSM related to screening prior to participation in health and exercise. So why do we even have a standard and a set of guidelines that's focused on screening new people? Here's a few things we know. So we know that we have a major focus, of course, it's our whole industry on physical activity here in our country, and we know that there's increased use and participation from past decades of people. And this increased use includes people that have very low levels of physical activity when they start, low to the extent that their health could negatively be impacted by these low levels, individuals that have cardiorespiratory illnesses or other metabolic conditions like diabetes or other serious health conditions. We also know that we have an increase in beginner level fitness participation. So this is because we have a growing number of an aging population that is used to now hearing these messages that they should be physically active. So they are coming to us to start in some sort of exercise and training program, but they haven't really grown up with that, hasn't been part of their life. We also know we have our obesity and type 2 diabetes epidemic. And so the standards and guidelines that we have really focus on this idea of a balance. It's a balance of keeping potential clients and including ones who may have these conditions, keep them interested, not scaring them away, making sure that they do want to come and stick with us, but we really want to minimize their risk that they have of a medical event either during or shortly after a training or exercise session. And so there's really a few ways or a few foci of these standards. First thing really is screening. So trying to find people who would be at a greater risk. And then the next stage after that is evaluation of readiness to begin a training or exercise program. And then knowing and understanding the major areas that are in the screenings and the evaluation process, which include current levels of activity, the actual presence of disease, so cardiovascular, metabolic, renal, or signs and symptoms, even if it's not diagnosed. And then really what's the recommended exercise intensity or the intended exercise intensity, and if all of these three things match up. So standard one, we're going to spend a little bit of time here, significant time here. The standard says over here on the right that operators should provide a self-guided or professionally guided screening tool to all new members and prospective users. And so again, to all, that does mean everyone, including people who do have no sign of any health concern or risk, maybe of a younger age, maybe who are current athletes, still important for everybody because a lot of health conditions aren't necessarily just age or inactivity or experience dependent. And over here on the left, the reason why we do this is to, again, identify people who might be at risk, identify people who would benefit from having medical clearance. And then this last aspect is actually really important. People who may come to us actually might be better suited, or at least initially, in a medically supervised program, which as opposed to maybe a more commercial type of program, like starting in with a 24-hour fitness or a boutique style gym, boot camp, Orange Theory, that kind of thing. So the recommended screening tools that we'll see in a minute, these are based off of position statements from the ACSM, a screening algorithm. So here's a picture of it. I know you can't actually read it in Canvas. I'll provide a readable version, but essentially so you should know it's a flow chart. And the other purpose of this, of having this screening tool, is it puts kind of the burden of proof, I guess, on us as the fitness professionals, which is a little easier than just sending everybody to a doctor regardless of any understanding of history. Because if every single individual had to have medical clearance before starting a program, that's a huge barrier of entry and people just wouldn't follow through with it. And we know with our healthcare system, it's not always an easy thing to see a doctor. And so at least we're kind of the first stage or first line of defense, and then we can filter people out, ones who should maybe have modified intensities or programming, ones that should get medical clearance, and then ones that maybe shouldn't start with us, should go another route first. So screening tools, again, looking for presence of these diseases, signs and symptoms, or any other major health concerns. And the other major health concern area, tends to just get washed over, glossed over quite a bit from the ACSM and the standards. But in my own past experience, working in a fitness center, currently training in one and working in many different ones, that's an area that does deserve some time, because again, even though we know that data has shown the cardiorespiratory, diabetes, those are major health indicators, but we may have an otherwise, a person who doesn't have those, who maybe is younger, but is still recovering from a major injury or has had a major surgery or is on some unique medications that might have some side effects that we're not familiar with. Or if an individual is pregnant, there is some major contraindications with that for certain types of exercise. And so, and even from anything going from a biological condition like pregnancy to an injury to some other medical condition that's not listed to even something that's more mental emotional. And so someone is, for example, on the autism spectrum. That's something that is actually really helpful to know as a facility owner and as a coach, because that helps us give that person their best experience. And then, or if someone has anxiety, for example, that also helps us make sure that really that they have a safe experience. And that's kind of the bottom line at the last statement. So any other major health concern that would impact safe exercise participation. The other tip I have is we really need to consider in our screening tool, we can add on additional things to what the ACSM has and the ones they have. And so if I know that my facility has group style fitness, if it has a lead coach who gives a lot of auditory cues, if there's loud music, an individual who has a hearing deficiency or some sort of hearing loss, they may not be as safe as they can if they don't disclose that, or if we don't ask them to disclose some of that, that connects with some of the context of our actual training facility. Or if someone has a lot of social anxiety and every single thing that we do is loud and in a big group, that may impact that person's ability to have a safe experience as well. And so it is important to make sure that we consider some of the other health concerns, and even if they aren't addressed specifically in a screening tool, later on, when we talk about orientation and having a positive member startup experience, that's where we can hit on some of those other areas that may not necessarily contribute to a medical event, but to emotional and physical safety in the space. So the ACSM gives us a few definitions that are used repeatedly in their documents. So regular exercise, we know exercise is planned and structured physical activity. And for their screening tools and for us when we express how to use these, regular means at least 30 minutes per 3 days a week in the last 3 months. We have light, moderate, and vigorous intensities. A little typo here in vigorous. Should be RPE of 14 to 15, and very noticeable, significant increase in heart rate and breathing. There are other things that the ACSM METs, for example, VO2 max, that they use to define the 3 intensity areas. But when describing these to people in the really practical setting, RPE scale tends to be at least a tool that people recognize, or it's easy to explain to them initially, or the heart rate, the breathing makes sense to them too. Metabolic disease is defined here as type 1 and 2 diabetes. CVD is anything that's cardiac, vascular, or cerebral vascular disease. And then signs and symptoms. This is an interesting list. Again, these are legitimate health concerns, issues that we don't want to happen to our participants in exercise, but we do have to keep in mind a new participant, someone who's a beginner, who doesn't have a context of what physical discomfort from exercise actually is versus physical discomfort from real pain in the body. This may be a little bit interesting, may require some additional explanation in the screening process, and absolutely, of course, later in any type of member intake or orientation and in actual training later. So discomfort in the limbs, for example, you might feel soreness in doing exercises. And so making sure people know, well, there's difference between being sore from delayed onset muscle soreness, for example, to having rhabdomyolysis, for example, which is a major condition impacting the kidneys and the renal system, and ongoing fatigue or ongoing pain. Or the last one, the unusual general or localized muscle fatigue. Well, in a workout, you are going to feel eventually fatigue. That's part of it. That's part of various intensities, part of progression, but it's a different type of fatigue here in this situation when it's a sign or symptom of a medical event or condition. So there's several tools the ACSM recommends. I'm just going to list them here in Canvas. There's specific examples of these actual tools that are shared that you'll need to look at. So we have two here, the pre-activity screening questionnaire. We see a lot of similar stuff. Same thing with the health screening questionnaire for exercise professionals. It looks at your current activity, signs or symptoms, or any past medical conditions, and then some sort of acknowledgement of truth or signature. And the top one has that because it's a self-completed questionnaire. The participant does this on their own, so they could do it in person at your facility. A lot of places will have this as an online part of their registration process. Many places will include these with just a release waiver as well. The second one here, the health screening questionnaire for professionals, this is one that is meant to be administered by an actual trained and certified in health or fitness professional in your facility. So this is likely done either over the phone or in person on an initial visit. And so this also has an evaluation component and recommendations for the next step. So using that algorithm we saw of what type of intensity or if they should see a medical professional. Two additional ones here, the health history questionnaire, very common one we see across a lot of places, not just in fitness. Fitness examples may include fitness assessment info as well, but we see these even in medical offices and other settings. So demographic info, primary care provider info, conditions, medication, history of exercise or activity, if there's any issues during their past exercise, and then their informed waiver, health risk consent. And then a very common one we see is the PAR-Q+. And so physical activity readiness questionnaire for all, that's where the plus is. And it has 7 initial general health questions that are meant to be self-administered. And then if the person indicates that they do have any of the contraindications, or if they have any of those conditions that are involved in those initial 7 questions, then they will need to complete the remaining part of that PAR-Q+ form. And so that has follow-up questions on the actual medical conditions, recommendations, and then a declaration or signing area where they declare their information to be true and accurate. Standard number 2. So we'll go a little quicker now. So standard 2 says these tools should provide a means for these members or new users to identify if they are at risk and if they should seek consultation. And so it shouldn't just be check off what applies to you, but it should have wording and verbiage that indicates there is a risk if they do identify with certain conditions, and that consultation with the medical professional is part of the process. And so basically it means it should be easy for them to figure out, oh, I could be at risk, I should have a medical professional tell me or assess me or have a conversation with them if this is a good idea for me right now. Standard number 3, in short, means that there needs to be a post-completion review process. And so this means that after a user completes these, a professional or a staff member, at minimum a staff member or software system should review these essentially to scan them for anything that would be a red flag. So some of the self-guided tools like PAR-Q+, a lot of these can be integrated into various member management software systems. Software can be coded to flag for any of these indicators they list, or a general staff member can be allocated to review these. So that could mean someone who is an actual trained health fitness professional, but maybe they work in operations, front desk, member management, recruitment, sales, that type of thing as well. But a professionally guided tool, according to this standard, this should actually be reviewed by someone who is health or fitness certified by an accredited organization. So that's really, we think of a strength and conditioning coach, certification in personal training, any of our typical certifications. Or it does include an individual with a 4-year degree in a kinesiology related field. So essentially someone like you all who is training in what exercise is, what the risks are, and knows what some of these diseases and conditions are. It's really just a place for accountability beyond just a cover our butts kind of method of saying, well, we had them complete a screening. It means that the screening actually has to be looked at by somebody. And really, if we think of best practice beyond what the standards say, as professionals, we do want to have consultation with our members, especially new members. And so what they fill out on their questionnaire, on their screening tool, should be grounds for a follow-up anyways, regardless if they need to see a medical professional for clearance or not. The fourth standard relates to the responsibility of the operator of the facility to really recommend clearance, medical clearance, if they indicate that they are at risk. And so this is important. And again, here's some practical advice to make the process easier. So if a client has indicated, yes, they have a cardiovascular disease, maybe they also have signs and symptoms, maybe they don't have an exercise or physical activity history, those for sure would be grounds for them getting medical clearance. It's very, very helpful and highly recommended through the standard to have a facility branded medical clearance form ready. I recommend having a few different methods of this. So we know we have different populations who have different technology proficiency. So having hard copies of these ready, something that you can follow up in an email as an attachment, as a PDF that they can then print and bring to their doctor, or even having it available on your website as a download. So again, I always think of, well, people lose the hard copy that they send, or it's not always easy if they haven't met with you yet to get it off of an email. But if they know they're going to get medical clearance beforehand, before they even connect with you, they can get that. They can download that from your website and go to the doctor first. It's important to also have space on that form that we give to the potential client to give to their care provider to fill out that a screening tool was completed. You can indicate which one, and even potentially what's the area that was flagged from that screening tool, because that can help the provider have use their time, the minimal time that they're with the individual, have a conversation about the risk factors and what type of activity, if any, is best for them. And just really making this form as easy to follow and understand for the user, and honestly also for the medical professional. For standard number 5, it's really the concept that the screening tool is a priority. And so basically, this is saying that if a facility operator knows that a member user has any of these chronic health diseases or self-disclosed medical issue, if they know that clearance is recommended before beginning a program. And so this basically says we need to make sure the screening tool is a priority. And the screening tool needs to be used, and there should be reminders on a regular basis. And so even if someone's been a member already and they've gone through this process, it means that on their maybe annual membership anniversary, they update the screening tool. They do it again, because people's health changes within a year. And again, especially if we're thinking of this detrained older population or more at-risk population anyways. And it's really of using the screening tool to find a balance between the urgency of making sure they follow up on these risk factors, but we don't want to scare them into not being physically active or choosing to train with us. And then also the balance between we want to get them in, we want to get them going on this program, especially if their motivation is ready and their discipline is present to do it, but we also don't want to overlook a risk and be negligent. So some additional practical tips. So I would build the questionnaire into the orientation and member experience course. A lot of times it's built into the waiver, a release, and build the follow-up when the staff person or the personal trainer, whoever it is, build that into like their first session or their orientation. It means it makes the member feel good that, oh wow, you actually looked through my information and you know a little bit about me, so I don't have to reiterate everything. We also got to keep in mind that people who have health risks, they may already feel uneasy about starting activity. They might be nervous, especially if they have had some sort of medical event already. And then it's also important to keep in mind that a lot of people don't know that they have health risks, and they might be very apprehensive to potential medical care, to even going to seeing a doctor or provider. And so it's helpful sometimes to have a guide for the user of what this process is like. And again, don't think of yourself as someone who's been in this industry for a long time and has trained their whole life or is used to be an athlete. Think of the person like your grandma, and this is the first time they've ever been to a medical facility. So I would include a guide, especially if you're going to send them to a medical provider for follow-up, a guide of what kind of questions. If you are someone starting exercise and you're being sent to see a doctor or other provider, what types of questions should you ask them? How should you spend that time in that appointment? What types of medical providers could you schedule with? Does it have to be a primary care provider? Could it be a nurse practitioner? Could it be a PA? What are some options? Can you go to, a drop-in clinic for this? Does it have to be this full scheduled appointment where insurance has to be involved, for example? A list of frequently asked questions would be great. And a really probably useful way to go about this process is talk to a current member, maybe that you already have a good relationship with, or to a medical provider who maybe is a member already or that you just know, about what this process is and how they can help troubleshoot to make it easier, and how it could be less of a barrier to a person actually starting or less of a blow off. So moving into our guidelines. This should be guideline number 1, sorry, not guideline number 2. And so here we see prospective members, and again, we know these are more recommendations and suggestions. They aren't exactly at the level of a standard, but it basically says someone who fails to complete the screening should be asked to sign a waiver to let them participate, and if they refuse to sign a waiver, they should be excluded from participation. So basically that means individuals do have the right to determine if screening is in their best interest. So that means they don't actually have to do the screening. They can decide. You shouldn't force them to do it, should encourage them to do it. But again, think of an individual who may have some significant negative experiences with healthcare in the past, and so talking about these certain things may just scare them away or may be a major barrier. So that's something we do have to keep in mind, but we do want them to sign our waiver. And again, we also see people that think they are too good or that they are above their condition, and we absolutely need them to sign a medical and risk release waiver before to participate. If someone refuses to sign the waiver, then of course they should be excluded from participation as legally allowed, which in most situations, if they don't sign a waiver, that is something you can allow to do. And then here's our actual guideline, number 2. If someone does the screening process, say they actually go through with it and they have some risk factors and they should go see a medical provider to get clearance to actually participate. But if they refuse to get that consultation, then they should also be asked to sign a medical waiver before they participate, but they should be allowed to. And again, if someone refuses to sign it, then exclusion from participation can be legally allowed.